video series for parents. Today what we're going to talk about is Spinabifida. Please remember that these videos are not intended to replace visits with your physician. If we can be of assistance here in our office, please give us a call at area code 775-359-7111. We'll display that number again after bit, or we'll display that number for you after bit. We can get you in same day if you're having issues, but we really can't provide good medical care over the internet. It's not in your best interest. So while we're happy to help you out here, we really want to see you in the office if you're having issues. So this is the name of my practice. This is me, Dr. Windisch, and let's just get a bigger eraser here so we can start to talk. So we're going to talk about Spinabifida. And the reason that's what we're talking about is, quite honestly, I had a request from a friend of mine and his scout troop. And those of you who know me know that I've been involved in Boy Scouts forever and ever and ever, and will continue to help out in any way I can. So this is for you, Greg. And I got to give a shout out to Troop 167 in Temple City, California, which is the troop Greg and I grew up in. So Spinabifida actually is kind of a garbage basket diagnosis, and by that I don't mean the patients belong in the garbage, but what I mean is it's not really a single diagnosis. It is a whole bunch of diseases, and they can run just a tremendous spectrum from very mild to extraordinarily severe. And they're not even, although they're caused by basically the same thing, they're not necessarily remotely the same. So we're going to start with the mildest, and that's something called Spinabifida occulta. And what happens in Spinabifida occulta is that the elements of the spine don't necessarily fuse together. The spinous body is kind of a disc here, and it has two processes that come out and fuse together. In a nutshell, leaving this dark center, and in the center of this is where your spinal canal, or the spine itself, the nervous elements of the spine runs. Okay, overlying this giant spinous body, and to kind of draw it in 3 dimensions here, this is all bone that I've drawn in red, but overlying this spinous body is another element that is cartilaginous called the disc. And it really pretty much covers an area, almost the entire bony spinal body here. Because I'm not the greatest artist, we're going to leave a little bit of space just so you can see. But what we're interested in is this area right here. Okay, in Spinabifida occulta, these elements here don't necessarily come together like they're supposed to before the baby is born, and result in a bony opening. However, the spine itself is contained in its own sac, and spines are supposed to be inside of a sac. That sac is called the meninges. Okay, and within that sac is some fluid called spinal fluid, or cerebral spinal fluid. Okay, but it's all contained, in the case of Spinabifida occulta, beneath the bony process. All right, these patients are not picked up until autopsy for other reasons, or somebody shoots a random x-ray and they see it. It's benign, it's harmless, and is of absolutely no consequence. We have really no idea how many people on the planet have Spinabifida occulta, because most of them do just fine, and nobody ever picks it up. Okay, which then brings us to kind of version 2 of the disease, which is something called meningocele. And in meningocele, this outer layer here, the meninges, might protrude through the opening bony elements. All right, and when that happens, you can see that protrusion. This is all covered by skin. Okay, and you can see this lump. Now, this is not normal, but per se is not dangerous. The nerves are still formed just like they're supposed to be, and the patient is still completely healthy. Now, we need to do some additional studies to make sure that the cord itself is intact, because there are some other things that can run in concert with this that do need surgical repair, and this makes you look like you have a tail, and so a neurosurgeon can repair all of this and stuff everything back down where it belongs. But from a medical perspective, it's not dangerous. And when we talk about spina bifida and spina bifida patients, for example, in your scout troop, this is not what we're talking about. Okay, what we are talking about is something called myelomeningocele. And in that, the meningeal elements protrude, okay, but so too do the nervous elements. So let's see, there we go, okay. And at this point, a lot of times, or most of the time, the skin is not intact overlying this, okay, at least not at birth. And for that matter, the top of the sac at this point in this more severe iteration of the disease is not intact. And so you have raw nervous elements exposed before the baby is born, and they erode and they get torn up. And at birth, rather emergently, a surgeon will have to start by patching this so that you don't get meningitis, and then they'll put a skin covering or a graft or something over the top. But in the case of myelomeningocele, if you're looking at, well, let's kind of scroll down here so that we have some blank screen. Let's scroll up. So let's scroll over so we have some blank screen to work with. So if we draw kind of a stick figure guy here in the back, and then draw his legs coming off. We'll make him seated. So we'll draw his legs coming off and his arms coming off here. I'm just such a great artist. This is amazing. Okay. But if your myelomeningocele is at this level, you're essentially paralyzed, either partially or completely, depending on how severe, from that point down. And if it's at this level, then you're paralyzed either partially or completely from this point down. And if it's at this level, you're paralyzed either partially or completely from this point down. How severe your defects are and how severe the findings are going to be for the individual patient really has to do with how high up on the back it is and how much of the nervous elements inside were damaged prior to birth. Okay, so this is, while all three of these, spina bifida, culta, meningocele, and myelomeningocele, are themselves represent a spectrum, within the world of myelomeningocele, there is a tremendous spectrum of disease depending on where the defect is and how severe that defect is. And in my next video, we're going to look at things we want to look at across those various levels of issue. And then the last and most severe form of this disease is something called ancephaly. And my computer's bogging down a little bit here. Whoops. Let's just try that again. So anencephaly. A-N-C-E. This is supposed to be a P. P. There we go. H-A-L-Y. And in anencephaly, the elements that make up the back of the brain don't form, leaving the brain itself exposed, and often large portions of the spinal column itself are exposed. And prior to birth, there's significant destruction to most of the brain, and in fact, you don't have a skull either. This is fatal, and the babies usually only live at most a few hours. And we really, it's difficult to do brainwave studies on these patients because their brain is exposed, but most of them are brain dead or near brain dead and surviving only on some minimal brainstem reflexes at birth. So you're not going to see these patients out in the community. You will see tons of people with spina bifida occulta. We take absolutely no precautions whatsoever for them. Meningoceles, those need to be repaired, A, for cosmetics, and B, they need to be imaged to make sure that they don't have any other coexisting defects that need repair. Myelomeningocele, which is a huge spectrum, and then anencephaly, which you can pretty much forget about because you're never going to see. So we're going to start with this. I am going to make another video that will talk about the spectrum of myelomeningocele and things to worry about with myelomeningocele. And Greg, when you're watching this, don't worry. I'm going to prepare a written document for you too, I promise. But I can do this fast and have this up for you before I even get back. So I hope this answers some questions. If we can be of assistance in my office number is 775-3, that is a 3, 597-111. We'll be happy to see you or your child the same day. We cannot help you over the internet. That is not in your best interest. Have a good weekend.